Hello everyone. Today's video to review the ADC practical exam handbook. The final one which was published yesterday. I've been waiting for this for long. Now we have the final handbook for the July exam, which will be starting. First batch will be at the 9th of July. All the best for candidates appearing in that exam. First of all, the things are more clear now regarding information about the exam. However, there is some lack of information. I will just highlight what are the main observations that I found on the final handbook. So the exam will be 2 days, technical day and practical day. The technical will start first with the technical day. So technical day will be 2 sessions, one session in the morning 3 hours and a session in the afternoon another 3 hours. And you will be required to do 6 of the technical tasks. They mentioned that the session will be either restorative or preparation session. So in the preparation session, you can get either cavity preparation, which will be only composite because amalgam is not there in the criteria. So composite cavity preparation, either class 3 or class 2. Second task which might come in the preparation, which is crown preparation, PFM crown preparation, because also FGC full cold crown is not in the criteria. So as long as it's not in the criteria, it shouldn't actually come in the exam. The third task which might come in the preparation session, which will be the endo access cavity task. So these are the 3 possibilities of the preparation session, which will be 3 hours, either in the morning or in the afternoon. And you need to pass on this session and also in the restoration session. We'll come through the scoring and the assessment later on in this video. The other session will be restorative. Restorative will be either amalgam restoration, amalgam class 2 restoration, the complex one that we were doing before. Second task which might come is the composite restoration, either class 2 or class 4 composite restoration. The third one in the restoration session will be the provisional crown. So these are the 3 possibilities. So they nearly have like 4 tasks in the restoration session to choose 3 of them, and they have also 4 tasks in the preparation session to choose 3 of them. Not the candidate will choose, the examiner will choose when they put the schedule for the day for you in the exam. So you will have 3 tasks in the morning, 3 tasks in the afternoon, 3 of them preparation and 3 restorations. And you have to pass in each session in order to pass the technical day. I hope it's clear about the technical now. Also the grades for the technical, it's nearly the same, change from the ideal name in the criteria towards very good. So it's very good, satisfactory, borderline and unsatisfactory. Okay. So next is the clinical, the OSCE. The clinical day, which is the OSCE, will be either the first or the second day. It depends on each candidate's schedule. But for the OSCE, it will be only half day. It's not full day. So you will have either the morning session or the afternoon session. It depends also on your schedule as a candidate in the exam. They mentioned in the OSCE there will be 10 stations. However, in this handbook they didn't mention exactly what would be the time frame. In the interim handbook it was 15 minutes. So I assume it will be the same, either 10 or 15 minutes or maybe a little bit longer. I think they made it open because maybe one of the tasks might need more time than the other. So it might be 20 minutes, nobody knows. So it might be from 10 to 20 minutes, I think, maybe maximum. You will also be given 10 stations. And for these 10 stations, it will be divided into 2 of them will be around clinical information gathering, which will be something like history taking. Another 2 will be talking about diagnosis and treatment planning. And these 4 are communication. These 4 tasks will be communication. You will be communicating with a simulated patient, and it will be observed by the examiners. The other 6 tasks, the rest of the 10, the other 6 tasks will be procedures. So this will be to check or to assess the clinical treatment and evaluation. It can be either procedures or maybe written OSCEs. These examples like rubber dam, X-ray, RPT design, these are the examples that they give on this part of the OSCE. These 6 tasks might be either observed or non-observed by the examiners. Okay, and also it depends on whether it's observed or not. It might be assessed on site or assessed later on. The first 4 communication ones will be assessed on site. Okay, so these are the 10 tasks for the OSCE. You need to pass both days, the clinical day and the technical day, in order to pass the whole exam. And in the technical, you also need to pass every session, the morning and the afternoon session, the restorative and the preparation sessions. For the scoring or the assessment, how do you do the assessment? It's a bit complicated. It's not as simple as before in the grading. I mean, before, if in order to pass, you got like 9 satisfactory at least, or 8 satisfactory, 9 satisfactory without any unsatisfactory, or 8 with only 1 unsatisfactory. So it's not as simple as before. Now they put something called, especially for the OSCE, it's called partial compensatory scoring model. So this means that they have like a domain or clusters. I'm not sure if you will be able to understand that very well or not, but they have like 5 clusters for the OSCE. These 5 clusters, you need to pass in each of them. So it is like a subject, or it's like a domain that you need to pass in each, not in each station, but in each cluster. So, for example, the OSCE will be 5 clusters. The first cluster will be clinical information gathering, which will be history taking. It consists of two stations. According to the examples that they give in the assessment handbook, that if you fail in one and get a good score or high score in the other one, it will be a pass. So in order to you can still pass if you fail one of the stations in the same cluster. So it should be in the same cluster. So for the history taking, when you get like 2 stations for history taking or clinical information gathering, if you got 1 pass, 1 fail, it's still a pass. The same for diagnosis and treatment plan. When you get 2, if you get 1 fail, 1 pass, still pass. For the 6 tasks for the procedures, the clinical treatment and evaluation, according to the example they mentioned, if you get only 1 fail of them, you can still pass. More than that, it will be a fail. The 4th cluster is effective communication. If you don't have effective communication throughout the whole stations that require communication in, you will fail this cluster. The 5th cluster, which is the last one, is the infection control. if you follow proper infection control guidelines throughout also all the tasks assessing infection control, you will pass the infection control cluster. In order to pass the OSCE, you need to pass all these 5 clusters. If you fail in any of them, if you fail in to deliver effective communication, for example, you will fail the whole OSCE, and subsequently you will fail the whole exam. The same for the infection control, the same for the other 3 clusters, which are the clinical information gathering, the diagnosis and treatment plan, and clinical treatment and evaluation. I hope it is a bit clear, because it's complicated. It's not as easy as before, but this is how they are doing it. That's all for the grading and the assessment. We'll also quick review on the handbook, the materials and the instruments that they will provide. They mentioned that you can't actually bring any materials or instruments or bearers to the venue. You need to get only the eye protection, and if you are using any loops. Other than that, you shouldn't get anything. They will supply everything, equipment, materials, instruments in the new center in Melbourne, and bears as well. For the materials, I don't have any comments on the materials, except that's not clearly flowable composite is mentioned. They mentioned kind of fissure sealing, which I'm not sure if it can be used as flowable or not, but I would suggest the candidates to email ADC and ask them about the flowable composite in particular. All other materials are good. I also found that they will provide wedge guard, which might be very similar to the fender wedge, so that's a good thing. At least you will have something to protect the adjacent tooth while you are doing the cavity or the crown preparation. And they have also V3 matrox system also, that's a good thing. For all the materials, the rest of the materials are good. They didn't mention what clamps they will provide or what x-ray holders they will provide as well. For the instruments also, most of the instruments are good. I didn't find the discoid chloride for the amalgam restoration. However, the Hollenbeck is there. Also, they would provide a hatchet. Most of the equipment that you will need, it's provided. For the burrs, unfortunately, not all the burrs that we used to use for the tasks are there. They are lacking some finishing burrs, the red and yellow band tapered finishing burrs. But also, if you can try emailing them and see if they can change any of the burrs or add any of the burrs for you. They included some of the good finishing tools, Softlex discs, Softlex finishing strips, and they have for Softlex discs all the colors, and for the strips they have the medium coarse, and for and also they included the enhance points and discs. And just the last thing to be discussed today is the criteria. So the criteria for different tasks in the technical day, it's part of the handbook. And as I mentioned earlier, there is no full gold crown or amalgam cavity preparation in the criteria, which means that these 2 tasks shouldn't come in the exam. The criteria is very similar to what was published before in the old handbooks. However, I find it actually more clear than before, because they give like a clear review on each part that candidates should look after in while they are doing the task. The only difference that I found, which is difference to make it more easier for candidates, most of the differences are getting the tasks more easier, not more difficult, if there is any difference. The only thing that I observed is in the PFM crown that the for the undercut, they mention it in the if you have minor undercut in just one surface, this will be in the satisfactory. Before, the minor undercut is straight to borderline, so that's a good thing. If you have an undercut in just one surface, this will be in satisfactory. However, if it is minor undercut in more than one surface, this will go to borderline. That's all. Just would like to add that it is very important, communication and infection control parts in this OSCE part of the exam will be very important. Also, infection control for sure will be assessed throughout the technical day, and also will be assessed on the OSCE, the clinical day, if there is any of the tasks that include infection control, something like X-ray and rubber dam, and if they have any sole infection control, separate infection control task. So infection control is important. Also, effective communication is important, because if you fail in any of these, you will fail the OSCE, and subsequently you will fail the whole the whole exam. So all the best for all candidates appearing starting from July. Please feel free to comment on the video if you have any question, anything, and also please feel free to share the video, and I will try also soon to do more videos, maybe in the next month, elaborating maybe more about the OSCE and the possibilities of the OSCE stations that might come in the exam. Yeah, good luck to all.